I am so honored to introduce my esteemed colleague, Dr. Lata McGinn. Lata McGinn is a tenured professor of psychology and director of the clinical program and CBT training program at the Furkhoff Graduate School of Psychology, Yeshiva University, and is the co-founder of Cognitive and Behavioral Consultants, CBC, an evidence-based center in New York. She specializes in the prevention and treatment of stress, anxiety, trauma, OCD, depression, and related disorders. Her extensive publications span peer-reviewed journal articles, chapters, and her co-authored books, Treatment of Obsessive-Compulsive Disorder and Treatment Plans and Interventions for Depression and Anxiety Disorders. In recognition of her achievements in the field of CBT, Dr. McGinn has earned the title of Beck Scholar and was appointed a Fellow of the Association of Behavior and Cognitive Psychotherapies, ABCT. She was awarded a Certificate of Appreciation by ABCT in recognition of her professional contributions made on a trauma task force following September 11, 2001, and has just won the Outstanding Service to ABCT Award in 2020. Dr. McGinn is a founding fellow and certified trainer of the Academy of CBT, is the associate editor of the peer-reviewed journal Cognitive Therapy and Research, and serves on the editorial board of several other peer-reviewed journals. In 2019, Dr. McGinn spearheaded a global initiative which found the World Confederation of Cognitive and Behavioral Therapies, WCCBT, and currently serves on its board of directors. She is also past president of the Academy of CBT and the International Association for Cognitive Psychotherapy, and has served on ABCT's board of directors and continues today as the chair of ABCT's International Associates Committee. Welcome, Lata.
Thank you, Jamie. Thank you to Jamie for that lovely introduction and to ABCT for this invitation to give the webinar. The talk that I'll be giving today is going to be divided into three sections. I'll be talking about the context of what we're facing today, talk about challenges that we're facing as a result, and then ways that we can cope. So the large part of the talk will be focused on the last section, coping, which will also have its own sections. So let's talk about the context to understand what we're going through, and I'm actually going to start before COVID. So our lives have been transformed in the 21st century, and even more so over the last 10, 15 years. So both adults and youth have been leading far busier lives, extraordinarily fast-paced lives at home and at work, and facing intense and ever-rising pressures, and facing some actual dangers such as climate change, terrorism, and then US-specific events such as school shootings, and so on. And now also with far less social support than ever before. In the past 10 years, there has been an increasing recognition of anxiety and depression, especially in youth, and a subsequent increase. College students also see a large spike in anxiety and depression now is the leading cause of disability in the world. The world has been hurtling at such a speed that we've all been on information overload. The digital age that we live in has been responsible for a large part of this transformation. We have been inundated 24/7 with news media, social media that fuels and increases our perception of danger and has now become ensconced as our 24/7 Jones next door. I remember saying to my husband last year that we're going so fast that one day I think that this warp speed is going to just explode and the universe will fall into a black hole and we'll start all over. So welcome to a black hole that none of us predicted. So much has happened in the world in the last 6 months. The world has not experienced a pandemic of this scale since 1918, economic downturns arguably since 1929. The racist killings of George Floyd, peaceful protests, violent clashes, looting, and so on. What we're experiencing is unprecedented and potentially could have serious consequences for our well-being. So what kinds of challenges are we facing? So here are some Bitmojis that I've shared with my friends over the last several months, right? So as mental health professionals, we're all experiencing the pandemic together. So the stress of getting COVID, the relentless work, transitioning to telehealth, teleeducation, managing and supporting colleagues, trainees, managing at home without as much help, not going out as much, not seeing friends, family as much, certainly Zoom fatigue, and for all of us, that compassion fatigue. So what's unusual about this time is that we're both on simultaneous overdrive and underdrive. So most of us have experienced anxiety and depression, some kind of sadness, which means that our emotion systems are working as it should. So COVID is a threat to us, and it should provoke fear. We may have suffered from COVID ourselves, or lost someone to COVID, or simply lost our lifestyles, which is certainly sad as well. So the question is it trauma, right? For some, yes. But the term trauma has been applied in our everyday society, in our language, in so many contexts by so many people that it seems to have lost some of its meaning. So in what way could the current situation with COVID be traumatic? Obviously, it is coming to the brink of death, whether due to COVID or racism, surviving or losing family members to COVID or racism. Less obvious is sort of the exposure that you might experience as, let's say, individuals who might be staying at home with family members who have abused them or continue to abuse them. So if you experience trauma, there are certainly a range of psychological conditions. It doesn't necessarily mean that you develop PTSD. There are a range of illnesses that you might develop. However, beyond sort of disorders, there are there's a range of reactions to adversity that all of us might experience: excessive fear, anxiety, worry, having an unusual startle response, not being able to concentrate, having appetite, sleep changes, fatigue, and so on. Essentially, our minds and bodies are reacting to a world that's suddenly different. It's so different and so startling that can lead to heightened emotions, cognitive reactivity, and problematic behaviors. So specific to COVID, you might also see traumatic grief, bereavement, and usually in that the nexus between grief and trauma, where you might have lost a loved one to COVID and you are not able to see them, they're in the hospital, but you're not able to visit. There might be moral injury as a result. I should have done more. I should be doing more. I should have been there for him. And the compassion fatigue that I mentioned before. So let's talk about coping. It's because the ways that we cope can ensure that we do the things that we can do to control COVID. We can't control that it's going on. We don't know how long it's going to go on for. But the way that we react to these circumstances could make things worse, for sure. So let's talk about what's been done to cope with adversity. So there are three areas that I'll cover, and I'll spend some time on the acute aftermath of adversity, and I'll focus a lot on the time to adapt. I'll spend less time on the rebuilding phase today. So let's talk about coping with the acute aftermath of adversity. So I'll focus on what we shouldn't do and what we should do. And much of this comes from lessons learned from the collective world wars. This psychological first aid is something that I'll go over. And this is a universal prevention model. So the lessons that we've learned is from trauma, really, where we've learned that approximately 2/3 of individuals exposed to a single trauma will have a normal acute response, and that will abate over time. And really the minority of individuals will develop PTSD. And that even those who develop PTSD, their symptoms will abate over time. So what we know from research about adversity is that resilience is the most common outcome. So the best message is not to assume that everyone will have long-lasting and significant harm, and that the mind and body have a strong capacity to recover. And one of the most productive things that the environment can do is really set the stage to help you cope the best. So as an example, I fractured my arm and upper arm in December when I was in York, England, and I was given a cast. So the cast is not something that can reset my bone, but it can set the stage and the environment so it creates that stable environment that holds my bones together. And that's really the kind of intervention that we're talking about. We're not talking about treatment. We're talking about setting the stage to facilitate resilience. So let's start with first what not to do. So critical incident stress debriefing is an intervention that dates back to 1983. It's given 24 to 48 hours after an adverse event or trauma, where you're in a group setting and you're given information about common emotional reactions. The trauma is reviewed. You're encouraged to, have some emotional expression. And it sounds innocuous enough. So what's the problem with it? And just as you think of the bone needing to be healed, you would never start physical therapy right away until your bone is healed. So one of the problems with CISD is that it's done too soon after the event. The other is that it sets a morbid expectation of recovery by reviewing all the things that might happen to you. So now not only have you experienced trauma, but you also might develop PTSD. And finally, the encouragement of the emotional expression, not only is it too soon, but it's often done in a context with coworkers or other survivors of a trauma, which is not a natural group, which could, with people with different varying reactions. So what we know from research is that it's ineffective at best or harmful in the immediate aftermath of trauma and may actually increase post-traumatic stress. And through that communication of those pathological expectations, and it might actually vicariously re-traumatize you. So it sounds like exposure, but it really isn't. And the World Health Organization has proclaimed CISD as and advises against its use. So based on that, what are the lessons about what not to do? It doesn't mean that you get out of the way and don't do anything, but you really are creating that stable environment that we talked about. So one is not to assume that you know what people are experiencing or what they've been through, that you don't assume that everyone exposed to adversity will be traumatized or develop PTSD. And we don't want morbid expectations of what might happen in the future, so not pathologizing symptoms. Most acute reactions are understandable and normal and basically expected given what people have experienced. So it's important not to label reactions and symptoms, diagnoses, conditions, or disorders. And naturally, none of us would talk down or patronize of someone that we're working with, but it's also important not to speak about their helplessness or their weaknesses or their disabilities, and rather to focus on the strengths. The other is, and again, remember that this is something that you may not be working with the client in a one-on-one setting. This could be someone that you've approached right after a traumatic event has occurred. So don't speculate or offer possibly incorrect information. It's okay to say, I don't know, they're trying their best, and give them safety information that you're aware of. And also not to assume that everybody wants to talk to you or needs to talk to you. And definitely not going through a debriefing process or asking for details of what happened or what is happening to them. Their brain is buffering them from the shock of what has happened. It's important not to pierce through that in the immediate aftermath. And so not probing for more details than they're willing to share. So that's a lot of different what not to do. So what do you do? And that brings us to psychological first aid. And what is psychological first aid? It really is an evidence-informed modular approach that's built on that concept of human resilience. It's given to individuals across the lifespan, those who've gone through some major adversity or traumatic incident. And the goal is to reduce stress symptoms and again, to create that stable environment so that the natural recovery process can occur. And so the goal is to reduce that distress and promote coping. And where does this come from? Now, it's not been tested in randomized controlled trials. So again, much of our present knowledge of treatment for emotional trauma in that acute phase, which is usually 10 days or less, derives from the lessons that we've learned in the world wars, where we've treated over 100,000 victims. And the goal is to have that strong supportive community with a strong expectation of recovery. So there are, what you're trying to do, so on the one hand, you're assuming resilience in most individuals, and you're providing very immediate, very proximal measures that are just there to restore people, combined with that acceptance of symptoms on the one hand, and yet the expectancy of improvement on the other hand. So there are 8 core actions of PFA. And we'll go through each of these. And what I'm going to discuss is really how to also adapt PFA for the pandemic, because you can provide this over the phone or a web-based platform. And you're looking to really provide comfort, support, letting people know that their reactions are normal. And you're teaching them some calming and problem-solving skills. It also helps the caregivers to deal with changes that people might be experiencing. So let's talk about the first, and that is contact and engagement. And again, this is not an intervention that's necessarily given by mental health professionals. It might be that you are at the site of a disaster, or you've just learned that someone has developed COVID or has just lost someone to COVID. The goal is to how to respond or initiate contact. The goal is to actively reach out to see if help or assistance is needed, but not to assume that help is needed or it's not needed. And it's really, the goal is to focus on what do you need right now. So your manner as the professional coming in is to not be intrusive, to be calm, to be empathic, and to give the person your full attention and communicate compassion, help, and doing so in a culturally sensitive manner. And again, promising confidentiality. The second is that you are providing, your goal is to be there for the person, to provide some safety and some support. So you start by acknowledging what has happened, providing them with the opportunity to share experiences and feelings of worry, anxiety, fear, concern about their safety. They might be experiencing sadness. They might be communicating grief, anger, guilt, shame, and communicating that it is acceptable to share all feelings. So your role in this is to listen, to empathize, to normalize without judgment. And again, to provide as much accurate information, what is being done to keep everybody safe. And while you're doing that, understanding that people might have developmental needs. Some might be physically in harm. They may be in a wheelchair. So understanding what needs there are. And your goal in this space is really to let people know that they're not alone, and to facilitate any kind of physical support if someone has lost their glasses, to provide them with a way to figure out how you can get them to safety, and certainly offering physical and emotional support. The third is, and this is an if needed technique, which is to stabilize. Sometimes the reactions people have when they are undergoing adversity or trauma is to really, they might be disoriented, they might be very emotional, they might be very reactive, it may be hard to calm them down. So the goal in this is to calm and ground someone who is emotionally overwhelmed or disoriented. You want to give them space and express your availability. And again, your demeanor, being as calm, quiet, present, and non-intrusive is ideal. And even if the reaction that they're having is very intense, it's still important to normalize their emotions and provide a brief education on the fact that these are common reactions to adversity and that you and other people are there. And then finally, your goal is to orient this person. So you want, if they're so emotionally overwrought, your goal is to sort of bring them down and bring them to the present moment and let them notice their surroundings. So I'll share a video that you can use to learn about the technique. It can also be used to help kids, to engage them if a child needs to be grounded. But this is the 5-4-3-2-1 grounding technique, which comes from CBT.
This technique will take you through your 5 senses to help remind you of the present. This is a calming technique that can help you get through tough or stressful situations. Take a deep belly breath to begin. Number 5. Look around for 5 things that you can see and say them out loud. For example, you could say, I see a burger. I see a bird. I see a soccer ball. Number 4, feel. Pay attention to your body and think of 4 things that you can feel and say them out loud. For example, you could say, I feel my feet warm in my socks. I feel the hair on the back of my neck. Or I feel the pillow I'm sitting on. Number 3, listen. Listen for 3 sounds. Say the things out loud. It could be the sound of running feet, an airplane flying by, or the sound of a dog barking. Number 2, smell. Say 2 things you can smell. It's okay to move to another spot and sniff something. If you can't smell anything at the moment, or you can't move, then name 2 of your favorite smells. Number 1, taste. Say 1 thing you can taste. It may be the toothpaste from brushing your teeth, or the flavor of your bubble gum. If you can't taste anything, then say your favorite thing to taste. Take another deep belly breath to end.
So that's, again, to stabilize someone who's in need of stabilization. So let's say now you've taken them through this process, and your goal, what is your goal in this space? To identify what their immediate needs are, pressing needs today, to gather more information. Has a loved one developed COVID? Have they experienced any losses? Are they separated from their loved ones? Are they living alone? Do they have concerns that they will die? And then identifying personal and commonly experienced trauma-related emotions and reactions. You might assess for any negative emotions they're experiencing, substance use, any suicidal or homicidal ideation or intent. But your focus is really on the immediate needs. What do they need today? And combine that with providing information, education, and really practical assistance. At the end of it, you would summarize and prioritize their needs if there are multiple needs that they need. So again, your goal here is to offer them practical assistance and address those immediate needs. So you're discussing those needs with them, coming up with a collaborative plan. Do you have a place to stay? Do you need someone? Can I call someone for you? What can we do right now? And guiding them to take steps to address those needs. And again, focusing, even though you have done that assessment, focusing on the person's strengths and prior things that they may have done to cope with adversity and what they may have contributed to helping others in need. Moving on from providing that practical assistance is connecting them with supports. So here your goal is to establish brief or ongoing contacts with their primary support persons or other sources of support. So first is you're emphasizing the importance of support, that you want a physical distance right now and social connection is important. Encouraging them to reestablish some kind of social connectedness. So whether it's receiving support from their family, could be their teachers, supervisors, peers, the clergy, doctors, pets, etc. And certainly a lot of people are spending time with family, but many are are alone. So encouraging even social distancing walks or games with family, playing music, working on home projects or chores, and other tips to promote online interactions. So whether it's Zoom Hangouts or online games or social media in moderation, especially for teenagers, and maybe joining web-based support groups. So your goal is to really emphasize that seeking support is important and offering support is even important, that both of those have that function of reducing your emotions and increasing happiness. Number 7 is providing them with information on coping. So providing information on stress reactions and coping to reduce the stress. So I'll spend more time going over this at the end, but again, the goal here is to provide them some basic information on coping and teaching them some basic skills that they can use in a day-to-day manner. And again, this might be sort of individualized for the person in how they can cope with stress and adversity, but I'll note those at the end. And so now you've come to sort of collecting, making that contact, communicating support, stabilizing them, gathering information. And now ultimately, again, your goal is not to provide treatment, but to link them to collaborative services. So whatever services that are available, so here I have included for all of you a PFA field guide where you can learn more about PFA. There are certainly COVID-19 specific handouts that you can refer to, and I've also included a PFA online course that you can take. So this is typically PFA is indicated in the hours, days, and weeks after a trauma. And then you move on to what we call a rebuilding phase. And this is a selective prevention, a secondary prevention. So the skills for psychological recovery are what you would use at this phase, but we're going to not spend as much time on this given that we're not sure we are in the rebuilding phase yet. So we are in this unusual time with a pandemic. It still feels for many that we are still in the acute phase, and someone may develop COVID today. So, there's COVID is increasing all over the United States as an example. It's increasing in other parts of the world. In New York, where I live, the rates have gone down. So different people are at different phases as well. So it's not quite clear if the rebuilding phase that we use is really appropriate. So the question would also be, when would you give that higher level of care? So at this phase, you're not providing this for everybody, but you really are identifying people in need. So somebody might have clinically significant symptoms, they might have persistent symptoms, impairment in functioning, or risk factors, and certainly those who request treatment. So let's take a look at the risk factors for what puts people at risk for needing a higher level of care. Generally, we know that females are more at risk for anxiety and depression in general. We know that they are at risk for developing PTSD. We know that having a past history of trauma or a psychiatric history puts you more at risk. We also know that the type of trauma that you might observe, and the closer you are to the traumatic incident, and if you've had multiple exposures to trauma, or you've observed serious injury or the death of another person, that certainly puts you at a higher risk of trauma. The degree of exposure is certainly important. There are other risk factors as well. So having obviously a loss of a loved one, we talked about traumatic bereavement. For social support, we know that social support is the biggest buffer for mental illness. We also know from research that if you have a fragmented memory at the time that you are going through a traumatic event in the acute aftermath, that might, set the stage for future PTSD. And then there are a range of unhelpful thoughts and behaviors that I'll go over. We also know that if you have community disruption, so your home loss, or you have had to move, or changes in neighborhoods or schools where it's not just you going through it, but the whole community has been disrupted, that leads to a higher likelihood that you will have more impairment in functioning and greater symptoms. So for people who are at risk, skills for psychological recovery comes from research on CBT. It's designed to help children, adolescents, adults gain skills to reduce ongoing distress and cope with that rebuilding phase. Now, again, all bets are off with COVID, but usually in the weeks and months following a disaster and trauma. But this is, in a sense, talking about trauma that has already passed. So we are in this space where, you're going through trauma and you're rebuilding at the same time. So again, like PFA, SPR is not formal mental health treatment. It's a secondary prevention model. And again, it uses techniques that we come from CBT and that have been found to be helpful in a variety of post-trauma situations. And some people will, of course, need a referral for treatment, but that skills building approach is more effective here in this stage as opposed to providing them just supportive counseling. So we won't be going over all the core skills in psychological recovery, but here are the 6 stages. So information and prioritizing, building problem-solving skills, promoting positive activities, managing reactions, promoting helpful thinking, and rebuilding healthy social connections. So I've included there a link to SPR, and there's a guide that you can review. But the reason I'm not going over it, and I really am trying to think about how I would organize this talk today, I was really thinking of how I could distill the skills that you learn in PFA, the coping skills, and the coping skills that you learn in SPR, in a nutshell, that might be helpful, taking all those pieces together. So at this point, with the trauma continuing and with us rebuilding, how can we integrate these coping skills in a nutshell? And how can we cope in this time, in these unusual times? So what I've looked at in coming up with these skills is looking at the coping skills in PFA and SPR, as I mentioned before, looking at research on resilience and PTSD, work done by David Clark, Anke Ehlers, research on depression, research on GAD, work by Thomas Borkovic, and how we can use that to apply to us ourselves and to our clients. So we'll start looking at this from a CBT lens. So what are the feelings that we've discussed today, right? So we might be feeling anxiety, sadness, guilt, shame, anger, right? And experiencing what might we be feeling in our physical bodies. So muscle tension, restlessness, feeling keyed up on edge, sleep disturbance, being very tired, not being able to concentrate, and being slowed down. So those are unhelpful feelings that we might be experiencing. So what behaviors? Now, all of us have experienced a disruption in structure and routine. So we know that lack of structure and routine can be unhelpful and make it more likely that you might develop anxiety or depression. Poor sleep hygiene. Now, workspace and home space has become the same. So sleep hygiene and general self-care it may be disrupted. And in general, we're experiencing less positively reinforcing activities, more punishing or negatively reinforcing activities. We'll talk more about that. And then other behaviors that are unhelpful is when we experience these negative emotions to actually try to suppress those reactions, not allowing natural emotions to just come and go. Some of us might be using substances to control emotions. And on the one hand, avoiding any reminders or activities, so not thinking about, COVID at all and not wanting to deal with it at all. On the other hand, many people are doing the opposite, which is selectively attending to threat cues and ruminating about COVID or other things that are disrupting. You've experienced so many events, it's hard to keep track. I mean, COVID is still ongoing, but especially in the United States, having experienced all the disruption that has occurred with the racist killings of George Floyd and resulting protests. And then some people cope with trauma by dissociating. So we won't be going into that in more detail, but again, these are all unhelpful behaviors that have been linked to future onset of PTSD, anxiety disorders, depression. And finally, let's look at unhelpful thoughts. And on the one hand, we might have excessively positive thoughts, sort of this optimistic bias that this can happen to us. So we know, for example, here in New York, where I live on the Upper West Side, everybody's wearing a mask. But if you go downtown, more young people, just going around in crowds, everything is open. So they might have the positive bias, that optimistic bias that this can't happen to me, or conversely, negative interpretations of trauma or what might be going on, and also the sequelae of that trauma. So it could be things like, this is the worst thing that has ever happened to me in the world. I'm ruined. I'm going to suffer forever. It might be behaviors that you might have engaged in that you are judging at this point. I'm ashamed that I've been eating too much, or I shouldn't have been feeling anxious. We also know from research that the behaviors of others in the aftermath, if you judge the behaviors of others, that can be something that makes you more anxious and is linked to more PTSD in the future. So, comments like, I wish my mother had done this for me. My boss wasn't checking in on me. And also assuming that the consequences of what's going on will impact every life domain. So assuming that maybe if you've lost your job, that you'll never get a job, or that I'll never meet someone. So each of these are linked to future onset of anxiety disorders, PTSD. And we know from looking at anxiety research that if we overestimate negative outcomes, if we perceive the world as more dangerous, then we do feel more anxious. So if we perceive safe events as dangerous, which is I can never go out, even with a mask, I'll never be able to eat out again, it keeps that continual sense of ongoing threat and impending hopelessness. So the idea that this is permanent, like what's going on today. So if you say, I will never get over this, the world will never be the same again, or I am not strong enough to cope with it, we know that these kinds of cognitions lead to more symptoms in the future. So if we take a look at it from a CBT lens, we know that these thoughts, feelings, and behaviors can interact and create this vicious cycle. So how can we adapt, right? So it's time to adapt. We don't know when this stress is going to end. So here's an acronym that might help distill down the things that we've discussed before, that what are the coping skills used in PFA? What are the coping skills used in SPR? What do we use in CBT when people are suffering? So we'll go through this. So accepting how I feel, dialing it down, actions to combat my negative emotions and cope, physical retraining to ease sustained tension, and thoughts to combat negative emotions and to cope. So let's start with the first. The first is to normalize and accept. And why? What helps me is to really go back to my evolutionary roots to realize that emotions are an alarm, right? They're there to protect me, to help me survive the pandemic. It's normal for me to be anxious. I don't have OCD. It is important for me to wash my hands for 20 seconds. I need to clean and disinfect, right? My brain is protecting me from danger. So understanding that those emotions are there for a reason helps normalize and accept. So on the one hand, you're empathizing, obviously, and validating that the suffering is real. So for some people, there's true grief in that they have lost loved ones. For other ones, they might have lost milestones. They might have not attended their prom or their graduation. My daughter is a freshman in college. She had to come home. So empathizing, whatever the extent of that suffering, and validating that as real. Also helping people understand that suppressing painful thoughts and emotions is unhelpful because A, it doesn't work, and we know that it ultimately increases more emotions in the future. Now that's one. But the other hand, we need to dial it down. We don't know how long this is going to go on for, right? And at this moment, if you're not in immediate danger, most people are not in immediate danger, right? So this could be going on for a while. So we need to calm our bodies, need to calm our brains, need to calm behaviors. So trying to dial down that level of fear so that we can function today. So generally, what can we do? So maintaining some kind of structure, stability, predictability, making all efforts to reestablish routines, rituals, and engaging in all the familiar rituals. We know that if you engage in familiar rituals, so even if you're not going to work, getting dressed like you're going to the office, working at a desk. And so that helps. And so obviously as you're doing this, you're making sure people are protecting themselves from physical harm as well, or psychological harm in terms of excessive media exposure. And then finally, stimulus control, right? So that's a behavioral technique where limiting not only the amount of media or that you might be ingesting, in addition to that, for example, working in only some areas of the house because that balance of home and work has fused, making sure that you're not with your computer on your bed, in the dining room, in your living room, right? So making sure that you limit the time that you are doing things that are unhelpful. And then coming back to evolution, right? Recognizing the function of these emotions. So let's look at sadness for a minute. So on the one hand, you need to rest, right? This has been difficult. So again, you need to rest and restore, both in moderation. So eating and sleeping well, needing some time to be on your own, solitude, right? That sadness is there to help you recover. In addition to that, right, you're also engaging in activities that create pleasure and mastery. So going for walks and playing, games with family members, creating some kind of mastery, some kind of helpful, some kind of pleasure, some kind of connection. So the balance here is to pay attention to the alarm in both ways, both to rest and restore. And then looking at anxiety, right? So again, this is normal. We need to be anxious. So washing your hands for 20 seconds, wearing a mask, eating cooked food, keeping things that you purchased for a while and then using them. So understanding that you need to do some avoidance, escape and some rituals, that's in moderation, that we need to physically distance. And we need to stay informed. However, we need to stay informed and yet restrict media and technology. So both are equally important. So, stopping working on your computer an hour before you go to sleep, or removing your phone from the room and sleeping in complete darkness, right? And not overdoing the rituals. So you don't need to wash your vegetables with Clorox or, Clorox your entire house. So again, recognizing the function of the emotion from an evolutionary perspective, that it is there, it's important for me to do this, and yet not too much. Then looking at physical retraining to sort of ease that sustained tension. So we know from the work of people like Tom Borkovic that, when you look at people who have the sustained tension in general, so people with GAD, that there are physical techniques. Now, many of you may have learned some of these techniques, but still it's a matter of applying it in a way that's maximizing its use. So adhering to it in a way that it actually helps. So dichromatic breathing is a technique that I'm sure many of you know about, but it's important to focus on all the elements of it. So looking at that, contrasting, hyperventilating and breathing, slowing down your breathing, breathing from your abdominal, creating that pleasant imagery and taking it to the level where you're actually achieving a meditative state. So going through deliberately, doing deliberate practice of it a couple of times a day. Now, progressive muscle relaxation, again, we know it's enormously helpful for people with GAD, people who experience that sustained muscle tension. So again, using, you can combine it with the breathing. So again, using the contrasting technique where you are alternating the Jacobsonian technique of contrasting tension with relaxation. Using pleasant imagery, imagine being in a place that's associated with peace, serenity, comfort, and then ultimately using an associated cue word to prompt yourself to vividly imagine, all the different sights and sounds that you're experiencing to be present in the moment. Now, ultimately, you can also use it and recall the state that you're in. Now, one of the things that we know from Borkovich's technique is that the idea is that you're not just using that progressive muscle relaxation, you're not just learning it, but you're learning at that moment to let go of your thoughts, feelings, and behaviors without force, accepting that they're there and then letting them go. So once you do deliberate practice of progressive muscle relaxation, then it's time to really use it in the moments. Now, this is a phase that I guess many people don't wind up using, but the way that it actually helps people with GAD is that when they learn how to apply it. So once you master that experience of letting go, when you learn to relax your muscles and you learn to let it go, your thoughts, feelings, and behaviors, once you've mastered that, then applying that when you notice early symptoms of anxiety or tension. And that's when you see that it works. Now, often we talk about, and it shouldn't be used as a safety behavior, but you're not using it as safety behavior, but it is important to actually use it to reduce tension. And so it's an important skill that we can all use today. And finally, your thoughts, right? So to combat your negative emotions and cope. So on the one hand, we want to now make sure we don't have that optimistic bias, but on the other hand, we also want to adjust our risk perception so that we don't feel that we're in danger all the time, right? So the actual risk should be equal to the perception of risk. So we know that we're not that great at assessing risk. So some of us are assuming we'll never get it, and some of us are assuming we're going to get it tomorrow and die. So as a result, realizing that modifying your cognition so that you can decatastrophize that most people, if they get COVID, will be fine. Unless you're in a category of you're a healthcare professional or you have a vulnerability, that you will be okay. Also, assuming that, your way of coping, that understanding that you are capable of coping. We know from anxiety research that the more you underestimate your ability to cope with adverse events, the more likely you are to experience anxiety. So again, this comes from research done by David Clark, Anke Ehlers, that what we know, and also collective data from the world wars, that resilience is the norm. So enhancing positive views, so it could be in the short term first, right? So enhancing silver linings, what are benefits to having COVID, the COVID era? One is that maybe you're not commuting to work, or maybe you have more solitude, and that's been good. You're focusing more on life essentials, maybe more time with your family. I know that as a mental health professional, I'm really grateful that I can work, that I'm able to work right now. Connecting more with others. I'm reaching out to friends and family that I normally am too busy to speak to. And understanding that the kinds of beliefs that you're trying to foster are not just in the moment, but also emphasizing that the impact is not only normal, but that this will pass, that it's usually less negative than they're experiencing and more positive, not just in the short term, but the long term. Next, we know that judgments of others and judgments of ourselves. So we know that if we have judgments of others after a traumatic event, we're more likely to develop PTSD. So fostering benign perceptions of ourselves, of others in that moment. So again, you're fostering like a balanced optimism. Yes, this is dangerous, and we know things will get better. And so towards that, fostering some kind of post-traumatic growth, which is what can we say that this will help? Will we focus more on life essentials? Will we focus more on our families? Will we take out all the things that kept us busy that weren't that important to us? And so, understanding on the one hand that what you're going through is dangerous, but understanding that this too shall pass. And so coming back, summarizing, right? So we're talking about accepting how we feel, but dialing it down so that we're not assuming that we are going to be, eaten by a tiger today, taking actions to combat negative emotions, understanding the function of the emotion, understanding what depression and anxiety are meant to do, listening to those alarms, and engaging in behaviors that would be helpful, using the vast knowledge we've gained about what helps ease sustained tension to do deliberate practice, and finally, thoughts to combat negative emotions and cope. And at the end of it, realizing that the world has gone through events like this in the past, and this too shall pass one day.
Okay, so we do have time for a few questions. And I just want to thank Lata and thank all of our attendees for making time today. Any questions, any more questions that you have that we don't get to, they will be disseminated and answered. So kind of starting off, Lata had posed, they were wondering how racial trauma combined with trauma from the pandemic plays out for children and people of color, since the effects of racial trauma manifest themselves in similar ways to the effects of other trauma, such as withdrawal, lack of trust, and hypervigilance to threat.
Right. So we know that people of color have experienced, more unforeseen, they've experienced more COVID, they've suffered more because of COVID. We know that, right? And we know that racism, as you mentioned, is a risk factor. So what we know from research on PTSD, for example, is that the more risk factors you have, the more likely you are to develop PTSD. So in a sense, when we're talking about racism, we're talking about intergenerational trauma. And so that would put people today at greater risk because you have it coming from all sides, right? You have COVID, which is affecting communities of color, particularly low socioeconomic status, is also a risk factor.
Somebody else posed, female gender is a risk factor. Is there any research on transgender and non-binary individuals?
Not that I'm aware of precisely, but we know that people who are, let's say, in minority populations in general, have more risk factors. So whether the minority, what puts you at a minority population is whether it's your race, whether it's your gender, whether it's you're transgender, whether you have a different sexual orientation. We know that those factors put people more at risk.
Another question is, as with many treatments, family, friends, significant others might be giving either implicit or explicit contradictory messages to what we're telling our patients in therapy, not validating and maybe even invalidating. How often do you involve the patient's external supports?
As much as possible, right? So I think as the mental health professional are trying to play both sides, right? So on the one hand, you're empathizing, validating that whatever reactions they're going through are normal, and you're trying to foster optimism and a sense that things will get better, that this will pass one day and it will get better, and that the impact of it is not going to be imprinted on you forever, right? And the reason we can say that is because we know from the lessons of trauma that most people do recover. So those might be seemingly contradictory messages, and it can appear invalidating if they're not balanced together. So if that's occurring in a family environment, it's extremely important to bring family members in who are probably going through the same thing.
And somebody asked, can you speak a little bit more about PFA and SPR for children, and what are the most important skills and mindsets to help them obtain in the rebuilding phase?
I guess yes, PFA and SPR can be done for children, for adults, for adolescents, older adults. It's done across the lifespan. So the last several skills that I went over are the coping skills. So they come from research on CBT, I know prevention research on PTSD, and depression, anxiety. So the coping skills that I went over are the key coping skills that you would use in SPR. And PFA, the focus more on PFA is to focus more on that support and facilitating that support, and there are some coping skills. But in SPR, that becomes bigger because now you're identifying individuals who are more at need.
Are there specific adaptations that would be recommended to account for the more chronic nature of COVID-19?
No. And that's the part that I'm struggling with, right? Because there is PFA is intended to be really within hours and weeks following a trauma. And SPR is intended to be in that rebuilding phase. And we are in this odd nexus. So that's why, in a sense, what I went over is sort of enhanced PFA and SPR today to help cope with the things that are coming up because of the pandemic. We're going back and forth between, having a resurgence, rebuilding, having COVID rates increase, then decrease and rebuilding. So it's not, not a linear recovery. We're still in this phase. And we know, for example, that this could get worse in the winter, right? So we know that we're looking ahead that this could get worse. So we're not really in a rebuilding phase in that sense. So focusing really looking collectively at the amazing work that's been done in CBT to help people cope with worry, depression, PTSD, and also the lessons learned from resilience research on what kind of mindset helps to protect you, to make you less vulnerable, I think is the best we can do today.
What about when someone has that sort of positive bias and it seems dangerous to us, not practicing social distancing, not wearing a mask in public? How do we address that with clients if they seem to be psychologically unaffected? Is this something that you think we should be trying to do?
Yeah, I think the balance is to have an accurate risk perception. So on the one hand, there are people that means we're not very good at assessing risk ourselves. So acknowledging that people have different levels of risk perception and that some people assume that there is no risk, whereas others might be heightening the risk so that they feel that they're in danger right now at this moment. They'll definitely get COVID and die. So using the same techniques to kind of recognize that emotions are there to protect us. And so if we keep that in mind, which always helps me, right, to realize that they're there. And so if I'm not experiencing the emotion, what could it lead to for me? So using our modification strategies and looking back at evolution to see the lessons of why emotions are there in the first place.
Okay, time for maybe one or two more. Let's see. How do you encourage online interactions for individuals who feel strongly that those online interactions just aren't the same and they don't see a point?
Yeah, so that speaks to the hopelessness, right, that people feel. So certainly the goal is not to increase online interactions so much that it's actually increasing stress or anxiety, but focusing on really what is in our control today, acknowledging, again, empathizing that it isn't the same, and spending time, taking time to empathize. So often when, as practitioners, we try to change behavior, we don't take the time to listen and empathize and validate sufficiently so that the person before us understands. So empathizing that you're right, online interactions are not the same. That's the best we have. Is there something else that you have that's better?
And maybe a nice way to end, somebody asked, could you just give us some authors that talk about resilience for PTSD?
I'm sorry?
Authors that talk about resilience, so some references for resilience.
Yeah, and I'm happy to send those along. But for example, one of the, the cognitive model that David Clark and Anke Ehlers, talk about all the cognitive beliefs that what puts people at risk. I'm happy to send that reference along and other references to people.
Okay. And so you all saw that Dakota said the slides are available. Lata is open to answering or elaborating on some of the questions posed. So thank you again, Lata, and thank you so much to everybody who attended today.
Thanks, Jamie, and thank you to ABCT.